Now it's the turn for Marc Wittmann to give his talk, and Marc is really the expert on timing in our consortium. So I am really looking forward to your talk, Marc. So the stage is yours.
Okay, thank you. So do you hear me? Yeah?
Yes.
Okay, good. So what I'll be talking now, the next 20-25 minutes is here's the agenda. And in the end, I want to come to a conclusion, which is the third point here on this agenda slide, that how video games and VR technology could be a fruitful tool for changing states of consciousness and time consciousness and having an effect, and that's our goal, on psychiatric symptoms and psychiatric states. And how I will come to this conclusion, I will show that first of all, I will give a foundational answer on questions of where in the brain and how time might be processed. And this will all about be the self, the body self and time, and importantly then explaining flow states, because we want to induce flow states later on in video games and VR. And the important link basically between the foundational work of how the brain creates time and related to the bodily self is that we'll be trying to induce altered states of consciousness through VR technology, video games, and I'll show you in other examples of altered states of consciousness in meditation, floating tanks, psychedelics, how self and time is modulated and how these induction techniques have a positive treatment effect on psychiatric states. And then we'll talk about the tool we are discussing this week, VR and video games. So first of all, a general introduction to Kai already gave an introduction, but here different angle maybe. But if we talk about time perception, we at least have to talk about two time perspectives, and one is the retrospective time perspective, meaning when we are looking back at past time intervals, the last week, the last month, etc. And they are important for judging duration are memory contents, or the amount of changing experience we actualize in perception. And so the classic thing is, of course, vacation and activity. We have a lot of experiences, memories, and subjective time expands. But in everyday routine, the same time span, because we're doing a lot of routine, the same thing over and over again, not so much memory content then is stored, and that subjective time seems shorter. This is a retrospective time perspective, but the prospective time perspective basically means experiencing time at present. And there the important functional module is attention to time versus distraction from time. And so if we attend to time, for example, in waiting time, in boredom, time passes slowly. And if we're distracted from time, because we're doing pleasurable activities, watching a TV show, having an exchange with friends, time passes quickly. So these are the two important time perspectives we have to keep in mind. And regarding this prospective time perspective or present moment time perception, I just want to present you the cognitive, the main cognitive theory model on this. And this is a pacemaker accumulator model where the amount of pacemaker impulses in an accumulator defines subjective duration. So the more pulses are accumulated, the longer subjective time. And there is now one functional module, this is attention, meaning this interferes in that only if we attend to time, then these pulses are stored in the accumulator. If we're not attending to time, because we're distracted, not so many impulses are accumulated, and then time seems shorter. And then there's a second modulator, and that's the arousal system, because this pacemaker not necessarily has the same frequency all the time, but might change, much slower, sometimes faster. And more arousal means faster pacemaker and more pulses accumulating. So more arousal also means, prospectively speaking, longer subjective duration. So we can apply this, for example, the classic waiting situation, and we did this in a real waiting situation, a mock waiting situation. We had people come into a room, and the experimenter said, please wait here because I have to set up the computer task in another room and I'll come back to you. But that was just a mock instruction. So people waited for exactly 7.5 minutes, and then the experimenter came back. And what, of course, then happens is that attention to time is high because you're waiting, you don't know when does this end. And there might be also arousal, waiting, you're bored, nothing's happening. And in this situation, what we could show that, first of all, trait-related, the more impulsive individuals were, the more unpleasant waiting was, and the longer duration estimate of waiting time. So also the correlation overall was also the more unpleasant waiting, the more attention to time, the longer the duration estimate of waiting time, and also the slower passage of felt time. So going now to the brain. So what I could show in an fMRI study was that there was in a certain brain region, which I'll come to you again shortly, we had increasing activity over time while subjects had to judge duration. This is a 9 seconds time interval they had to judge, and we have this increasing activity over time, which stopped only at the end of the presented interval. The same with an 18 seconds interval, so quite long durations. And so the question was, when we measure time, maybe through increasing activation with increasing duration in this particular brain region, the insular cortex, and more precisely, the posterior insular cortex. So posterior insular cortex, what is the insular cortex? So that's a little bit textbook knowledge. So represents physiological conditions of the body. It's important for regulation of physiological needs, but also when we think about Antonio Damasio's theory, it's about the interpretation of physiological states, which is the basis of complex human emotions. And so there are a lot of neural imaging and lesion studies showing how the insula is related to physiological needs, to emotions, but also complex decision-making. We have this proverbal gut feeling, but also meditative states, to which I will come a little later. So the working hypothesis is that the insula encodes subjective duration. When we had beforehand, we had this funny notion of pulses in this pacemaker accumulator model, but maybe we can fill this now with pacemaker being physiological states which are accumulated or received in the insular cortex. So time is not perceived in the outside world, but through interoception by the material self, or if you think about the phenomenology of Merleau-Ponty, we're talking about embodied cognition, embodiment, which generates our feeling of subjective time. So the same framework again, the pacemaker accumulator model. So now suddenly these two modulators is one, attention to bodily states, for example, meditative states, waiting time, time expands, and increasing bodily arousal in affective states, which modulate subjective time. And so there's a whole list of hundreds of studies which you could summarize at how emotions, body self, and time are related. So in psychophysics, events with emotional content are judged to last longer. Individuals with fever overestimate time. States of boredom are defined basically by a slow passage of time. A nice study I found was that time passed more slowly when smokers had a physical urge for nicotine, but were not allowed to smoke. And surprise, effortful emotion regulation also correlates with overestimation of duration. So emotions, body, and time. And now to psychopathology and time perception. And David Vogel already nicely explained us in detail the qualitative reports. It's all about an overestimation of duration, a slowing down of subjective time. And there's different other examples with patients with cancer and anxiety, drug-dependent patients, or in general, impulsivity as a symptom of many psychiatric or neurological syndromes, which are related to an overestimation of duration and a slowing down of subjective time. And we had the two groups of Kai Vogelei with working on depression, autism, and Angir's group with schizophrenia, where you have already heard and will hear more. So this is just a little cartoon showing with psychiatric disorders that they may be stuck in present time and have this overestimation of duration. And we find this in several psychiatric syndromes. You find down in the bottom left and in different, related to different symptoms, where the present moment is over present, yeah, and the future is far away and time slows down. We're stuck in the present time. So the hypothesis is now that self-consciousness, self-body consciousness and time consciousness are modulated together with time consciousness. So if you have an intensified awareness of self, body feelings, we have also an intensified awareness of time. Or if you have a weakened awareness of self, body feelings, less awareness of time. And this is, of course, now the next step to show that in altered states of consciousness, self and time are strongly modulated. And we will use this now for our, for example, flow experience, where we are so absorbed in activity that we lose our sense of self and time. The classic example, of course, for example, video gaming, where hours may pass very quickly. This is flow. And boredom, waiting time, as I showed, is the opposite, is this intensive and negatively felt self, and you have also the time dilation. So we have these two opposites, flow and waiting time or boredom. So when I'm talking about the self, of course, we have to be a little bit more careful. So we have there are a lot of different conceptualizations about self. I would just want to talk about two different ones. One is the sense of bodily self, to which I referred now earlier with the insular activity. It's all related to feeling of presence, of being here and now, of body awareness, whereas the sense of a narrative self is something else. It's more about mind wandering, getting lost in thoughts, memories, future plans, and of course, also importantly, of rumination in psychiatric syndromes. And we have also neural levels which distinguish these two parts, different types of self, more the interoceptive body system, including insular cortex, and then more the resting state network encompassing the cingulate gyrus, the cortical midline. So why altered states of consciousness in psychiatry? To rephrase it a different way, as a Paul Ignitsky, a PhD student, I coached a little, and he had a very nice PhD thesis where he worked on this idea. So showing that psychiatric symptoms like depression and anxiety are all about hyper-awareness of self and time, rumination, negative mind wandering, and also a loss of connection with other people and the world. And the core features of altered states of consciousness are antithetical to these 3 points, right? In the sense that you have less awareness of self and time, you have a decrease of mind wandering, and you feel more connected with other people and the world. And I'll just quickly go into the empirical literature on meditation, psychedelics, floating tanks, and then go to video games. So for example, timelessness and meditation. So I'm just highlighting here several journal article headlines, yeah, where it is very clear that in experienced meditators you can show a dissolution of self and time. And meditation nowadays is also used for therapeutic means in different psychiatric patient groups, but also for stress-related problems of students, of workers. And this has, I think we are talking about hundreds of studies showing how meditation has a beneficial effect on stress-related symptoms, on emotional stress. And this might be related to this dissolution of self and time during meditation. And floating tank, what I like to call the floating tank, it's something like an instant meditation. You know, you're in a dark room maybe, or chamber, and you have some sort of perceptual deprivation. There's no light, no sound, only interoception, your bodily self. You're floating nicely in warm water, salt water, that's why you're floating. And you lose your outer sense of connection to the world, to the water, because it's body temperature. And at the beginning, you have quite a few quite a bit of body perception and time perception, both intensified, but then you lose this at some point, and later you feel relaxed and lose your sense of self and time. And leading by Justin Feinstein, 2-3 studies now already showing how the short-term anxiolytic and antidepressant effects of this flotation rest, again, probably related to the loss of sense of self and time, acting against the symptoms of anxiety and depression. And the last one, psychedelics, yes, LSD, psilocybin. What you can show in now already dozens of studies, which are now popping up everywhere in US, in several parts of Europe, but not in Germany. The very first study again is starting now in Germany, in Mannheim. With psychedelics, what you can achieve is an ego dissolution, a dissolution of time, and a feeling of disembodiment. And so again, this could be the answer of why psychedelics have, as you can read here, the headlines, have a therapeutic effect on treatment-resistant depression, for example, and other symptoms, also drug dependence, for example. Okay, now going to the last important step for this week. So I'm referring now to one study here. You can read the headline and you see the authors from Hamburg University, and they use the video game Boson X, which is a quite dynamic video game. And the rationale was that they would induce flow and absorption in the game, being presentness in the moment in patients with depression. So they had to play this game over 8 weeks in several sessions, similar to the number of treatment sessions that you would have in psychotherapy or in meditation. And what they write is they focus on depressive symptoms and on rumination. So rumination, sense of narrative self, since rumination is a good predictor of depression and may contribute to triggering depression. And what they showed was that indeed the video game training group showed significantly lower self-reported rumination at post-test. So the idea is maybe through altered states, flow states, symptom reduction was induced. So this is an important thing for also this week, but in general also for our EU study, designing video games in VR for inducing flow experience, and related, of course, to the famous Mihaly Csikszentmihalyi with his flow conceptualization. What are components of flow experience? Intense and focused concentration on the present moment, loss of reflective self-consciousness, and a distortion of temporal experience. In peak experience, a loss of sense of time. So in virtual reality, what we can induce is greater absorption and more flow, and as an even larger, even greater absorption than just purely video gaming on a screen, but plus the virtual reality environment. We have a very, very powerful tool to induce absorption, and we have what we could show, and we will show later in our empirical data, we have larger perceptual and behavioral effects with virtual reality. And Shiva Koshnod and Federico Alvarez-Igarzabal will show this later, our individual studies we conducted during the EU consortium experiments. And Shiva is a bioengineer and doing also EEG studies. And Federico is an expert in game studies. So we have the combination of both game studies and experimental psychology. Thank you for listening.